afternoon, viewers, and welcome to Health 360. I'm your host, Alicia Martin. Joining me today is Dr. Oneka Scott, the Maternal and Child Health Officer attached to the Ministry of Public Health. Welcome, Dr. Scott.
Thank you, Alicia. You look very colorful today.
Thank you, Dr. Scott. So, our topic for today is COVID 19 and pregnancy. I know that the ministry has been making strides in regards to COVID 19 social distancing at clinics. Dr. Scott, tell us about that.
Yes, Alicia, I'll be happy to share what we have been doing so far. As you well know, that maternal and child health services are deemed essential in this period, and by that I mean the care of the pregnant woman, the postnatal care, um, the care of the child, immunization, family planning, everything around that realm. And so it is important for us to remember that although women need to access the health facilities, they also need to be very protected when they access those facilities. So, as of March, clinics have been staggered to ensure that there's no full waiting room. Appointments have been rescheduled, especially if you're early in the pregnancy and you have no high risk. Then your healthcare provider may have made contact with you at some time to reschedule an appointment. Appointment times and dates are being given, and the ministry is urging that women keep those particular dates. You're expected to wear a mask to protect others when you're at the facility. And of course, the idea behind wearing a mask is if everybody wears one, then everybody is somewhat protected. Healthcare workers are going to be very well suited with their personal protective equipment when they're attending to pregnant women at the health centers and at the birthing sites. And I want to particularly add concerning hand and surface hygiene at the health facilities that's happening more frequently as is prescribed by infection prevention norms. So we want to take into consideration that although it may not be a quick in and a quick out when our clients visit the health centers, it is all for all of our safety that we adhere to the measures that are, especially when you receive the calls in most of the regions, women are being called from the facility. Sometimes it may happen early in the morning. Sometimes those calls may be made in the afternoon. The healthcare worker identifies themselves, say why they're calling. Sometimes it could be to reschedule an appointment, like I said earlier, or for telemedicine or teleconsultation, or we're tracking defaulters because in this period we are aware that restriction in travel, restriction in gatherings may cause some of our women to miss appointments that are key. And so it's a twofold approach because if you have the number of the health facility, you are, of course, welcome to call your health provider and they may be able to add additional information to your management.
Thank you, Dr. Scott. Are pregnant women at a greater risk of being infected with COVID 19?
Um, that's an interesting question and one that we have gotten a lot. Given the fact that this disease is still new, we're still learning a whole lot about the science around it. But so far to date, there's no evidence that shows that pregnant women are at a higher risk in comparison, to other women or other individuals who are non-pregnant. We want to remember, however, that in pregnancy, a woman's immune system is naturally weakened. And if you have a naturally weakened immune system, it means that you're more susceptible to viruses and bacteria, correct? And this weakening of the immune system is naturally physiological because that is what helps the body not to reject the baby. And so viruses can be opportunistic. We know that in the case of influenza, pregnant women are sometimes more susceptible to the common flu and influenza. Data is still coming in, however, and from the limited studies that we have seen, they have been very good outcomes for both mother and baby. Pregnant women are encouraged to do the same thing as other women, which is take all the precautions to ensure that they're safe in the pregnancy. And I guess later on in the interview, we'll go into what some of those precautions are so that we can have those reiterated for the general public.
Okay, if a pregnant woman do get COVID-19, is she more, does she become more sick than the average person who is infected with COVID-19?
So far, there's no data to support that, and that is really comforting. Um, as I said before, we know that certain viruses like influenza can be a little bit more severe during the pregnancy, but that immune suppression is relative. And so, women who have had COVID 19 with the studies that we've had so far have had very positive outcomes in most of the cases. This is not something that the World Health Organization has identified as having a greater risk or a greater outcome. However, I want to reiterate we still want to take all necessary precautions.
Yes.
Mhm.
So if a pregnant woman is infected with COVID-19, could she transmit that to the baby?
That's another good question, Alicia. That was one of the first things on some of our minds. And based on the, once again, limited studies we've had, there have been negative sample results for cord blood, placental blood, in the amniotic fluid as well for the virus. Some neonatal swabs have been negative. And so, although we still do not know if the virus can be transmitted from a mother to her baby during the pregnancy at any stage, whether it's the first trimester, second or third trimester, um, there's been no evidence so far to show that there has been transmission. Of course, you want to take into consideration that after birth, the mother can still pass the virus on to her baby if she's positive in the pregnancy and if she does not take all the respiratory precautions, respiratory hygiene, surface hygiene necessary to keep that infant safe.
Thank you, Dr. Scott. What measures are in place for antenatal service, even when mothers go to the clinics and so forth? Are there any measures in place to ensure that even as they go outdoors, that they do not contract COVID-19, even at the clinics?
Going outside for pregnant women should be only for essential reasons. Pregnant women are to adhere to the same infection prevention control measures that the general population is advised on, and that's avoiding gatherings, whether large or small. Sadly, avoiding gatherings with our family members and close friends. They're advised to practice strict hand hygiene, wash your hands as frequently as you can with soap and water, uh, practice regular surface hygiene, respiratory hygiene, wear a mask, and most importantly, self care. We want to watch ourselves for signs and symptoms if we're pregnant, and if we discover any signs and symptoms belonging to the list of COVID 19, then we want to contact our care provider and seek an intervention. Pregnant women can also call the hotline, as you know. As we said earlier, When visiting the health facility, there are some measures in place. You'll be asked to wash your hands. You'll be asked to be seated far apart. You'll be asked to come a particular time so that the waiting room is never crowded. Even the health provider who attends to the pregnant woman will be taking their own precautions not to themselves be um, a source of transmission. We know that about 35% of the people tested in Guyana have been asymptomatic so far, although they've had positive results. So we want to be cognizant that pregnant women need to be protected.
Definitely. What can pregnant women do to protect themselves at home?
Well, if you live in a crowded space, then you may want to ensure that all your family members are very very well aware that the same measures you're taking at home, the same measures they should take
Yes.
whenever they go for essential services. You really don't want to have a situation where in your own home you're at risk because maybe another family member is not taking the precautions that they should be taking. Pregnant women need to clean surfaces very often. I know that depending on the stage of pregnancy, certain smells of detergents and alcohol may be repugnant to the pregnant woman. They can have somebody else clean for them. They want to be careful not to share utensils whenever possible. They want to be very strict in exercising and taking their prenatal supplements and the exercises if there's no contraindication. And in their own spaces, one of the things that has been proven to improve outcomes is when you increase or improve on your health literacy. So pregnant women want to do their own research, they want to read, they want to educate themselves. When they do that, then they're more cognizant of what measures should be taken.
Yes. If a pregnant woman who has COVID-19 delivers a healthy baby, how could she prevent the baby from getting COVID-19?
We want to reiterate that there have been some studies identifying positive cases of newborns. We're not sure if those babies were infected during delivery, after, or maybe in the postnatal stage. But most importantly, anybody who does not practice respiratory hygiene and comes in contact with a newborn and is positive for COVID 19 can be a source of infection, can transmit the disease to a newborn. So, a mother wants to ensure that she does all the things we said before to take care that that neonate is well protected. She wants um, to ensure that she practices respiratory hygiene, to not have baby in contact with everybody and almost nobody at this time, to keep baby very safe in a clean environment always. And that will really help, along with hand and other surface hygiene and all that's necessary with care of a newborn.
For those mothers who are anxious about giving birth, do you have any coping methods that they can use at this time?
Yes. Pilates helps, yoga helps, those Lamaze exercises help. You may want to read. The clinics are open, those that have access to telephone for you to call your provider. There's no provider that's going to turn any pregnant woman away when they call. Of course, if they're busy with the patient, they may return a call, but seek your coping mechanisms within your network as well. There are friends and families that you can reach out to. Most people are encouraging WhatsApp meetings, Zoom meetings, Skype meetings, and then you have your Skype time set aside. And pregnant women are encouraged to have these groups where you will discuss maybe your baby names, what's the next stage of your pregnancy going to be like, what's happening to your body at this period of time, how your baby is growing. And you want to share that with your spouse so that it's a bonded moment for both of you. And then there's reading to your baby. There's nothing like reading to the baby in the womb. It's a soothing feeling, and you encourage fathers to read to their unborn children as well. Because science has identified a very strong psychological bond when that is done. And then if all fails, you want to do your research. You want to address any issues that you may be having, any unresolved issues, whether it be tensions at home, tensions with your spouse, any fears that you may have about delivery or going out or going to the health center. You have to have those questions answered, and you seek ways in which they can be answered. Either you contact your healthcare provider, or if it's social issues, you speak to a relative or somebody who is very trustworthy that you can confide in. And those are the things that we have been advising, that you leave no unresolved issue in the pregnancy. Even outside of COVID-19, those things need to be addressed. You know, pregnancy can be a very stressful time, and coping mechanisms are key to find in this period.
Thank you, Dr. Scott. Before we end today's program, do you have any final word of encouragement to all of our mothers who are watching right now?
Yes, you definitely want to get enough sleep. You want to stop. You want to do your breathing exercises. Breathing at very paced intervals help you to relax. You want to wake up early in the morning, watch the sunrise, do your stretches, meditate. It really helps. And for those of us who have access to reading material, we can read as much as we can. But most importantly, we want to rely and trust our healthcare providers. Ask questions, reach out to them, and they will get back to you in this period of time. It is important, Alicia, that we recognize the work of the people on the ground,
Yes,
providers who are going above and beyond, those of us who are working at the centers, at the birthing facilities, our midwives, nurses, medics, or physicians. Even in some instances, in the hinterland regions, it's the community health workers that are attending to our pregnant women without let up in this period of time. It will help us all if both the general populace as well as our healthcare workers adhere to the measures and the guidelines that have been directed by the ministry, so that we may all come out of this pandemic very well and healthy.
definitely. Thank you so much, Dr. Scott, for joining me in the program today. Thank you.
Thank you, Alicia, and do have a pleasant rest of the day.
I will. I would like to say thank you to all of our healthcare workers, all of you who are working hard out there to keep us all safe. Thank you so much. We do appreciate all that you're doing. This is where we say goodbye for now on Health 360. Do stay safe, Guyana.